Hello everyone. Good evening. Welcome to the Gyaan Vardhini session. I am Aarti Mishra from Team Clinsav, and it's truly exciting to have each one of you with us today. We can wait one more minute as the few more members are joining. So we can start with the session. Thank you everyone once again for joining us. And we have got a packed agenda ahead, delivering you into the fantastic topic of clinical assessment, specifically basic tongue analysis. Later on, we'll open the floors to your question during question and answer sessions. Feel free to engage us through the chat box, making the session interactive and insightful for all. We are thrilled by the fantastic turnout today, and I sincerely thank each and every one of you for investing your valuable time with us. Let's get to know each other a bit in the chat box. Can you share your from where you are joining today and one thing you are hoping to learn and discuss in this webinar? I would request everyone to n- share your locations in the chat box. Moving on to the introduction of the speaker, it's my pleasure to introduce our distinguished speaker for today, Dr. Sanjana Bhole. She holds a BAMS degree from Sion Ayurvedic College and has pursued MD in Rasa Shastra and Bhashacya Kalpana from RA Podar Ayurvedic College, Mumbai. Currently, she is an integral part of Ayurvedic Clinic in Kandivali, where she engages in a collaborative group practice alongside with the colleagues Dr. Hema Nanavati, Dr. Snehal Makhwana, and Dr. Hetal Shah. Dr. Bhole's professional expertise lies in several key areas with a keen interest in Vid and Agni Karma. She brings a wealth of knowledge and skills to this specialized field. Her dedication extends to addressing infertility concerns, providing valuable insights into Ayurvedic approaches for fertility enhancement. Furthermore, Dr. Sanjana Bhole is a passionate about diet and lifestyle counseling. Her commitment to holistic health shines through as she guides individuals on the path of well-being through personalized and sustainable lifestyle choice. Join me in extending a warm welcome to Dr. Sanjana Bhole as we are eagerly anticipating her for valuable insight in today's session. Now we can go with some of the instruction for the webinar. Please enter your full name to facilitate smooth communication. Keep your microphones turned off to minimize background noise. If you have any questions, feel free to type them in the chat box. Also, for the webinar control, you can use your raise hand feature if you have any question or want to speak in about the topic. We'll address your question during the question and answer session. Additionally, we'll share your questions in the chat box and I'll call out your name for one by one discussion of the same. I would request Dr. Sanjana Bhole to start the session. Over to you, Sanjana ma'am.
Thank you so much, Aarti. Am I audible?
Yeah, you are audible.
Okay, thank you so much for a kind introduction. Hello and good evening to all of you. It's really an honor to be talking on this topic in front of you. So, without wasting any more time, and with salutations to God, Lord Dhanvantri, let us begin this topic. I'll just share my screen. Is my screen properly visible?
Yes, ma'am, it is visible.
Okay. Before directly jumping into the topic, I remember a quote said by an American physician which says that diagnosis is not the end, it's just the beginning of your practice. So, for reaching a diagnosis, a physician needs a lot of clinical tools which help the physician to evaluate the individual's functioning in multiple areas and thus help to make an informed decision about the disease and the way of treatment. In Ayurveda as well, we use conventional clinical examinations which include darshan, sparshan, and prashna. Any diagnosis of any condition is incomplete with even if one part of this is left. So in a way, we can say that all these components complement each other and help us to understand the patient's condition and fortify our diagnosis or decision. Also, when we consider Ayurveda, we consider human body as a whole entity. It's never like कि सर में दर्द है तो हमको पेट की दवाई क्यों करनी है कि पेट का सर से कुछ रिलेशन नहीं है. Whenever there is any condition, we have to know what is the nature of the condition, how it has begun, what is its progress, the nature and the koshta condition of the patient, the stool condition of the patient, lifestyle of the patient, and the dosh involvement, etc., before coming to a diagnosis and basing our treatment on that. So, I would say that any treatment is incomplete without clinical assessment or assessments, as we cannot base clinical diagnosis pattern on any one assessment. We at Ayur Clinic, we use multiple ways of assessment. When the patient comes to us, the assessment usually starts with the moment he enters the clinic, the way he walks, the way he sits, the way he talks. After the initial assessment, questioning, history taking, we assess the abdomen of the patient, nadi of the patient, tongue of the patient, stools of the patient, and much more depending on the case. So after assessing all this, only we come to a conclusion and then write a prescription. So when it's about today's topic, tongue analysis is a part of the assessment which we do. Okay. Now you would ask why tongue analysis? One moment. Okay, so we say that the tongue is the mirror of the viscera. It gives us the exact idea of the status of how the internal organs are functioning, and all this picture is depicted on the tongue. Also, it helps us to understand the body's constitution by giving us an idea of the doshic picture of that person and what is happening in his body. It is also useful in many cases when the patient cannot visit your clinic in person and you have to know about his condition, his present condition, which can be easily assessed on the basis of the tongue. Also, stool examination. Moving on, this is the Ayurvedic reference of tongue examination which we find in Yog Ratnakar. Jivva Pariksha is mentioned in Yog Ratnakar as a part of Ashtavid Pariksha. It says, Jivva Shita Khara Sparsha Sfutita Marute Dhika Rakta Shyama Bhavet Pitte Kafe Shubra Ati Pichila कृष्णा सकंटका शुष्का सन्निपातादिकेतुसा मिश्रिते मिश्रिते ज्ञेया सर्व लक्षण वर्जिता. What it wants to tell us, what we understand from this shlok is that we understand on the basis of the color and the texture of the tongue that which dosh might be involved in this, in a particular patient. So in case if there is vataj dushti or vataj imbalance, the tongue will be cold, it will have a khara sparsha, rough texture, it will be sfutit, like it might have cuts or fissures in them. In case when there is pitta dushti, the tongue will look reddish in color or shama, that is brownish in color. In cases when there is kapha dushti, it will be ati pichila, like the tongue will look overtly slimy. In cases where all the three doshas are involved, the tongue will have a picture like it will be Krishna, like blackish, thorny, sakantaka, and dry. In cases when two doshas are involved, Dvandvaj Lakshan, mixed symptoms may be seen, or there is a possibility that the tongue might not show any symptoms involved. Okay. Now the next slide, I would like to I would like you all to see both these tongue pictures and tell me in the chat box what do you see in this and what do you observe. Let's take a minute and we wait for your answers. I'm not able to access the chat box along with the presentation on. How do I do that, Aarti?
Just a second, ma'am.
Yeah. Yes, I read certain replies. Okay, Dvandvaj, Vat Pitta, geographical tongue, second one. Okay. Second picture coated, cracked, central ridge border, rough. Okay. Okay. So what we actually assess in the tongue when we see the assess the tongue in the clinic. Okay, so the first thing which we observe is the margins. So in what is a margin? Margin means something which has an edge or a border of something. So when we think of a margin, we expect it to be a well defined entity or it having a clear cut shape. Now moving back to the other slide, you see these two tongues. The first one has a clear smooth margin which looks also very nice, whereas in the second picture it looks very wavy, ill-defined as well as non-symmetrical. Now, what do these ill-defined or non-symmetrical margins denote? They actually denote how is the nutritional status of the person, how is the lymphatic drainage, is the nourishment reaching to each and every part of the body. So, when we consider absorption of nutrients is not happening properly, we can say that there will be a ill-defined or wavy kind of margin to the tongue. It can also indicate that the karma of pranvayu is affected because when we say the karma of pranvayu, grahan is considered grahan of anything, anna or nutrition in each and every cell is a karma of pranvayu. The second possibility is that the grahani or the Purishdhara Kala is not functioning properly and the Sarkitta Vibhajan is affected. Thus, there is a Vikrut Rasa formation which indicates Samanvayu Dushti as well. Thirdly, if the Vikrut Rasa further travels in the body because of the Vyanvayu effect, it also indicates Vyanvayu Dushti. There is a fourth possibility for the reason why malabsorption or absorption of nutrients can be faulty is if the patient is not chewing his foods properly. Okay. The second point which we see is alignment. Okay. What exactly is alignment? Alignment basically refers to a straight arrangement in a straight line or in its correct position. The Prakrut tongue is supposed to lie straight. The tip should be in line with the tip of the nose and symmetrical. If the tongue's tip is directed either to the left or right of the patient's, it indicates that he or she may have some spine issue at that site. To fortify your diagnosis, you require to do a spine examination for the same. A wrongly aligned tongue can cause speech issues in the future, also malocclusion of teeth. The third aspect which we see in tongue diagnosis is the thickness of the tongue. Now, if the tongue is thicker than a normal tongue, with or without change of color, it usually corresponds to samavastha in the body, which further corresponds to samanvayu and pachak pitta dushti. This patient may suffer from bloating and have a Shoth-like pathology in his body. 1 minute. Okay. Next, what we assess is the 1 moment. There is an echo in my other phone. Okay, sorry. Next, what we assess is the coat in the tongue. When we talk about the coat, we see the spread of the coat, the color of the coat, and the thickness of the coat concerned. Now, coat refers to a layer of toxic buildup over the tongue. Now, this can be uneven, more at one part compared to the other, lesser or absolutely no coat on the other part. Depending on the area covered, and we can relate it to the organ which might have certain pathology, which we will see in the further slides. Now, when it comes to the topic of coat, the color is very important. It tells us about the dosh involvement in the body. If the coat is blackish or towards blackish side, we consider Vat involvement. If it is towards white or whitish side, we consider that Kapha involvement is may be present. If it is of any other color, say yellow, yellow-white, green, purple, bluish, grayish, it suggests pitta involvement. A bluish or purplish bluish coat indicates congestion in the concerned part, where we can say that Rakta Dhatu pathology might be involved, usually seen in Vat Pitta Dvandvaj kind of dushti. To go more in detail about the coat, it is also possible to see that if the coat is limited to a certain area and it is showing certain characteristic related to that dosh, it might be possible that the person or the organ of that body will be suffering from the ailments of that dosh. For example, if the coat is thick or frothy in the lung area, the patient might have respiratory pathology related to the kapha dosh, for example, cold or asthma. If there is a yellowish coat in the stomach area, we can say there is pitta involvement and certain gastric pathology like peptic ulcer, gastritis, epigastric burning, etc. can be present. If the coat is thick in the posterior part of the tongue, the patient is likely to suffer from irregular bowel movements, incomplete motions, bowel urgency, irritable bowel syndrome, constipation, etc. The thickness of the coat also specifies the amount of the toxic buildup in the body. So depending on the toxic buildup and the symptoms in his body, it can correspond to Saman Vayu or Apan Vayu Dushti, less lack of Pachak Pitta or increase in the amount of Kledak Kapha. Again this coat can be generalized or localized. With proper treatment and over time, we see that each layer keeps shredding and ultimately the tongue achieves a healthy pink color. Many times when the superficial layer comes off and we see the coat is lodged in the papillae of the tongue which specify lean dosh in that specific area. No treatment is complete until all that lean dosh is scraped off from that place. The next thing that we see in the tongue is the surface. When we see or when we check the tongue, we observe the surface of the tongue. We check if it is even, uneven, raised at other place, depressed at some place. Does that depression correspond to any specific organ or any specific part of the tongue? It is seen that usually when there is a depression in the heart area, it signifies that the patient might be holding on to some grief, some depression, some sadness, and has not yet let go. Okay, a healthy tongue is supposed to have certain small pink bumps which are the papillae, and they are responsible for the rough texture and serve number of purposes. But anything apart from that and or other than the raised papillae, other than normal, it might indicate that that particular organ is struggling for nutrition. If the raised papillae are red in color, they denote that the person might be having too much heat in the body. That can also correspond to loose motions, hyperacidity, ulcer formations, inflammations in the body, headaches, or anger issues, etc. One more entity which you generally see in terms of surface is this blank spaces. You can see in this tongue the blank spaces or the bald patches. Medically, they are called as geographic tongue or geographic patches. The name is given as a geographic tongue because it resembles the land masses and the oceans as shown in the map. The modern view for this geographic tongue corresponds to conditions like eczema, psoriasis, any allergies, type 1 diabetes mellitus, reactive arthritis, some vitamin deficiencies, maybe zinc, folic acid, B6, B12, or even emotional stress. What we assess when we see these blank patches is that that particular area or that particular organ isn't receiving proper nutrition. The circulation of the concerned areas is either partially or completely obstructed due to some or the other entity. It can be in Ayurveda, it can correspond to avrutta nature of pathology. Correcting the Agni as well as the path of the Vayu helps in regeneration of these bald patches and we see new papillae forming. Okay. Another one aspect when it comes to the surface of the tongue is the cuts or the fissures. The cuts on the tongue are again a very common finding in a routine clinical practice. Cuts or fissures in one or more area denote bath imbalance in that correlating organ or area. The depth of the cut signifies the degree of Vata aggravation. The deeper and more prominent the cut, the higher the degree of Vayu vitiation. In such cases, when we treat the Vayu, the cuts and the fissures initially become superficial and then slowly fill up. Next aspect when we see the tongue is the moisture. Okay, moisture maintenance of the tongue is basically and mainly done by the bodhak cuff. It lubricates the tongue, the buccal cavity, gums, and the throat. If due to vayu vruddhi, the bodhak cuff gets dried up, the tongue may look dry. If the tongue dryness is because of both vayu and pitta, the tongue will look more drier comparatively than the vayu, only vayu vitiation. The patient might experience hotness in the breath. He will have excessive need to keep on sipping water, Trishna like pathology. Also, in condition, if there is excess of bodhak cough, the tongue will look frothy, the patient will be experiencing excessive salivation, and he might be wanting to keep on spitting every now and then. Usually, increase in the bodhak cough also corresponds to am in the coast or amajirana like situations, but it has to be otherwise also assessed by other means. Both these dry and frothy tongues can be managed very well with Ayurvedic treatment just by dealing with the dose vitiation and coast correction. The next point which we see is the central ridge. As you all see in this second picture, there is a ridge along the center part of the tongue. It's a deep crack which is running through the center. Sometimes it can be partial in certain parts, sometimes it can be up to the full length of the tongue, which indicates vayu aggravation in the spine region. If along this uh, uh, central ridge you find horizontal cuts, it indicates certain pathology related to the vertebrae of that region. Okay. The next point which we assess is the spots. Usually, when there are spots on the tongue, they signify a krumi pathology. Color may differ, it can be red, it can be black, it can be brown. Treating such people on the basis of Krumi Chikitsa principles will help the patient with other symptoms in his body also. Okay. The next slide I would like to show is the one which corresponds with the organs and tongue. Okay. If you can see in this picture, the tip of the tongue and slightly below it is the area of brain, neck, and esophagus. If you find any pathology or any tongue changes in this particular area, you can ask the patient questions related to that and you might get the diagnosis. To the left and right, you can see the lungs, okay, the right and the left. Centrally, you can see the heart. This is a heart region. Below it is this is a stomach region, and just below it you will find the pancreas. To the right is the liver and to the left is the spleen. The stomach further continues into small intestine and large intestine regions. You can see the ascending colon, transverse colon, descending colon further leading to the rectum. To the left and right of the large intestine, you can see both right and left kidneys, and the parts at the end to the right and left of the rectum correspond to the ovary part. This whole central line from tip to end also corresponds to the spine area in the body. This area beside the neck region, beside the lungs, corresponds to the shoulder area, and this two bumps at the end correspond to the hip region. If the patient is having any spine pathology, you might see that one bump is slightly higher than the other bump, and you can then question and assess accordingly. Now there are 2-3 things which you need to know when you are assessing a tongue. Firstly is you need to be sure of the sides of the tongue. Like when we are seeing a tongue, the side corresponding to the doctor's right side is actually the left side of the patient, and the side corresponding to the doctor's left side is the patient's right side. It is very easy to get confused in both in these side issue. One more technicality is to be considered when you take a tongue picture. Firstly, the picture of the tongue should be taken in a good proper light. The whole tongue from the tip to the end should be clearly visible. If you are taking a photo with a flash on, be careful that your flash should not shine on a certain particular area, which might give you a misreading. Okay. Also, it is advisable that you ask the patient to be in a sitting position when you take a tongue picture, because usually the angle changes when the patient is lying down and he tends to move his neck towards you. So a sitting picture is always helpful. Moving on, we'll go further and see certain case presentations which we are dealing with presently in our clinic. Again, to remind you, these patients aren't being treated just on the basis of tongue examination. They have been assessed otherwise with other examinations as well. Okay. Now, this is a case of a 8-year-old male child. He had his present complaints were headaches, disturbed sleep, snoring, cramping in the legs. He had already issues like suffering from short temper, anger issues, adenoids, and ADHD. If you consider his hunger, it was manda. He had very high sugar cravings. He used to wake up every night at 2 a.m. and in the morning he used to not feel fresh at all. On examination, we could see that the skin dryness was double plus and the blackness, the karshanya around the knees was 4 plus. Now, let's see his tongue slide. Okay. These are his tongues, which are exactly 1 month apart. In the first picture, just ignore these white spots because that kid had been eating something when he came.
Hi everybody. It looks like we have seen a drop for Dr. Sanjana. So we are just trying to get that straightened up, and we'll. Dr. Sanjana, are you there?
Yeah,
Yeah,
am I
I'm sorry,
audible?
Doctor. Yeah, I'm sorry, Dr. Sanjana. There was some change
Yeah,
in the
okay.
settings. Yeah. Okay.
Okay,
Please.
so
I hope you can continue now.
yeah, but
Yeah.
was everything up till now audible?
Yeah. I think we just lost the last 10 seconds of what you were saying. So if you can
Okay,
repeat that. Yeah.
okay. I'll start with the case
Yeah, I'm sorry for
presentation.
that. Yeah. Thank you.
Yeah, no problem. We can start with the case presentations again. Okay, now this case is of a 8-year-old male child. He was a known case of adenoids, attention deficit disorders, anger issues. When he came to us, his complaints were headaches, disturbed sleep, snoring, cramping in the legs. Manda, his hunger, Shudha was Manda, and he had extreme sugar cravings. His Nidra was disturbed, and he used to get up at 2 o'clock every night, not fresh in the mornings at all. Skin dryness was double plus, and there was distinguished blackness around his knees. Okay, now let's see his tongue pictures. Now these are
Dr. Sanjana,
Uh, s-
can you share the presentation again?
oh, okay.
yeah, the slide is not.
Oh, sorry. Yeah, is it visible now?
Yes, yes, it is.
Okay. Now these tongues are 1 month apart. So in the first pic, just ignore this white things since he was eating something. You can notice that there are this white spots, sorry, this red spots over the tongue, and also look at the thickness of the coat, which signifies Sam Avastha. In spite of not being hungry, he was being force fed, which caused so much of arm formation in the body, which later thus laid the foundation for Krumi Utpatti. Now you see the next picture is see how the layer of the coat has reduced, even the spots have faded off. One more thing you can see is at the tip you can see small red beads which have kind of faded in the second one. The red beads in the brain area usually denote Pitta Adhikya, and it also denotes that the patient might be ill-tempered or having certain anger issues. The treatment which we gave for him was Krumigna Chikitsa, diet understanding, and these are the changes. Okay. Moving on, the second slide. This is a case of a 41-year-old female patient. She had extensive leg cramps, weakness, knee pain double plus, ankle swelling double plus, very bad mood swings. On days she would be happy, on any moment she would feel emotional, she would cry. She was unable to walk properly without support, had a lot of morning stiffness. The stiffness used to even disturb her sleep at night, and she was diagnosed as anti-CCP positive. Mala pravrutti was once in 2 to 3 days, sticky, and it was incomplete. And her Shuddha used to vary. Certain days she used to feel very hungry. On certain days she used to not feel hungry at all. In the next slide, let's see her tongue. These are the changes approx 10 to 12 days. In the one which is dated as 7/12, you can see how the central ridge is prominent. Also, you can see the sliminess of the coat over the tongue. Now in the second picture, the sliminess has gone down considerably. The ridge has also become superficial. The tongue looks cleaner, but still there is a toxic load in the lean dosh format. You can see it lodged inside, which still needs to be removed. Now anti-CCP positive is an autoimmune condition which can fairly correlate to Amvat in Ayurveda. With certain diet changes and certain medicines, we were able to achieve these results. The treatment we used for her was Pachan, Deepan, Anuloman, Ahar, Lagu Ahar, and proper rest. Moving on, the next case is of a 42-year-old male patient. His complaints when he came to us was constant abdominal discomfort since 1 year, for which he had taken allopathic medicine, which for certain time gave him relief, but later it had stopped working for him. He used to experience bloating after meals. There was to be pain in the left flank. He used to have low back pain on and off. The nature of his stools were he had urgency in his bowel movements. He was not feeling hungry. There was Shuddha Mandya, but still he used to eat without hunger. Okay, now we'll look at his tongue pictures. These are his tongue oh, sorry. These are his tongue pictures. In the first picture, you can see that the thickness of the tongue, and you can compare it with the third picture. The thickness of the tongue has considerably reduced. Also, the pale grayish color of the tongue has slowly changed to pinkish. You can also see the thickness and assess the thickness from the folds at the back. See the area which is visible here and see the area which is visible here. This also denotes reduction in the thickness of the tongue. Okay. The coat in this part of the tongue has considerably reduced, and now the area of coat has also comparatively being reduced. Okay, the treatment principles we used were Pachan, Deepan, and Grahi Chikitsa. Okay, moving on. The next case is of a 67-year-old female patient. She had developed interstitial lung disease along with rheumatoid arthritis. Actually, rheumatoid arthritis was the first thing, and then later on, as a second thing, she developed interstitial lung disease. This lady has been coming to the clinic for past 7 to 8 years for her treatment. Her symptoms are weakness, shortness of breath, cough with a yellowish expectoration, mala pravrutti once a day, semi-solid, sticky, and Shuddha Mandya. On auscultation, we found crackling sounds in both the lungs in all the lobes initially. Over time and with treatment, now presently the crackling has been restricted to the lower lobe. Her X-ray also shows these improvements. With the help of Ayurvedic medicine, over time we could have achieved this. Now, when we see the tongue of this lady, you can see this brown, blackish, brownish, purplish congestion over the lung area. When she came earlier, 80 to 90% of her tongue was of this color. We had pictures of early tongue images also, but presently they have become untraceable. So, but still on the present condition also we can assess her tongue. So over time you can see how the thickness of the coat has reduced. You can see bald patches which are slightly filling up in the consecutive follow-up. The upper layer of the discoloration has shredded off, so the deeper layer has started being visible. For auntie, we have been using Pachan, Kapha Vilayan, Bruhan, Rasayan, Chikitsa. So in this case, as the stage used to change, the treatment principles had to be changed and decided there and then. Okay, we could not always give Pachan and Karshan for a long time, or just giving Bruhan or Rasayan for a long time. Okay, the next case I have taken specifically. Okay, first I'll tell you about the case. This is a case of a 48-year old female. She has hypertension, dyslipidemia, endometriosis, dysmenorrhea. Her present complaints are dysmenorrhea double plus and bloating. She has heaviness after the meals. Her mala pravrutti is urgency, and she could see food particles in her stools, and the nidra status is dreamy. Now we'll assess her tongue. So this is a case where you can see what happens when during the treatment, the patient does some or the other kind of apatya, and how the tongue manifests it. Initially, she followed every advice and everything we said, but later on, as she started feeling better, she started asking for many kinds of wine and dine concessions. You can see that from 25/11 to 13/1, there has been improvement in the tongue. But after all kinds of concession, the tongue has started, as the costa condition deteriorated, the tongue also started showing its picture. So this case I've taken specifically to show that tongue examination helps you to also assess that how much the patient is following your advice, and we can even use it as evidence when to show it to patient that what happens when they ask for many concessions. So about this lady, the husband had come to our clinic asking that my wife has been taking consultation and medicine for so much time. Why is that her pain initially subsided and later it began again? So we had to show him all these tongue pictures, and that's only when he got convinced that it was because of the apatya done that the improvements got halted and it started deteriorating. uh, to Before I conclude, there are certain things, certain observations which you can easily look and have a diagnosis. Is if you see a thick white coat or a dry or wet and the tongue is swollen, you have to think about arm utpatti, agni mandya, Shuddha Mandya in this patient. Even if the patient says, no, my hunger is okay, I am feeling hungry, you have to poke in more and ask the patient about the further ask further leading questions. Another thing is you have to assess when you see that the tongue has a yellowish or whitish coat, you can relate it to Sampitta like conditions. If you say the tongue is very pale or it looks faded, you can consider that there is a Sang kind of pathology in the Rasa and Rakta Dhatu. If the edges of the tongue are very reddish, you can come to a conclusion that there is excess pitta in the body of that patient. Okay. Now, moving on, to conclude, I would like to say that clinical assessment in Ayurveda has very less references, and also Jiva Parikshan has very less references, and hence it is easily underused tool of examination. Also, absence of symptoms in a patient does not always mean that there is absence of disease or the normalcy of dosh have been achieved. The samprapti bhang has to be achieved, which can be assessed on the tongue. Until then, we cannot say that that the disease has been totally cured. Okay, as we had earlier discussed, it is a go-to method for outstation patients. Usually we don't prefer online consultations, but when we do, we base our treatment on the basis of their tongue and stool picture along with other questioning. And the best way to learn tongue is to see as many tongues as possible in the regular follow-ups, since and ask questions and record your observations, and try to correlate it clinically and see how right you are and how the treatment has reached. So to sum it up, tongue analysis helps you to understand how the treatment is acting on the patient and also how the patient is reacting to your treatment. Okay. And thank you uh, for your time and for your participation. I would like to take this moment to thank Dr. Hima and Dr. Snehil for helping me with the presentation. Big thank you to Dr. Ramaprasad sir, from whom we learned a lot through the tonguology lectures. We had always been doing tongue analysis in our clinic, but after this lecture we got to refurbish our skills. And a big thank you to the whole Clinsav team for giving me this opportunity for presenting this topic. Thank you.
Thank you, Dr. Sanjana, for being there. We have few of the questions, and participants who wish to ask any question can drop their questions in the chat box. We
Okay.
have we have a question here from one of the doctor Jitiksha.
Mm-hmm.
Sorry to pronounce if it is wrong.
Mm-hmm.
If peripheral edges have small black patches from childhood itself, then we
Mm-hmm.
should consider it normal or not.
If as far as I know about this, I think that if there are peripheral ages with small black patch, some or the other malnourishment must have happened, even when that jiva development must have taken place in the womb or during lactation, or when he was. And we have to consider how the nutritional status of the mother was there. I would request Dr. Hema if she can add something more to this.
Yes, Sanjana, what was the question? Sorry.
The question was if peripheral edges has small black patch from childhood itself, then we should not consider it normal or not.
See, in certain cases, it could be considered as normal, but majorly we have seen that even tongues which are black since childhood, if we keep correcting the system, the black color changes and fades to brown. And then slowly over a period of time, when we just keep correcting the digestion and the lean doshas, it gets corrected to a reddish pink patch and then it gets converted to the normal pink. So whatever cases I have seen, I think it is not normal. It can be corrected.
Okay. Uh, Somebody was asking about the repeat the tongue coat and the pathology. Okay, I'll just share the screen again. Okay. Okay, so when we consider the coat, so the coat of any kind is a layer of a toxic buildup over the tongue. Okay, so if you say that the color of the coat is blackish, we have to consider that that part will have vataj involvement. If it is whitish, kaphaj involvement. If any other color like yellowish, yellow, white, green, purple, blue, gray, you have to consider that there is a pitta involvement in these cases. Also, what I want to say with the pathology of the coat and the tongue is, if the way we had seen in this organs and tongue, that if there is a whitish coat, say in the lung area, okay, thick or a frothy coat in the lung area, it is possible that the patient might have certain pathology in the lung area due to kapha dosh. Like it can be cold, it can be asthma, depending on the thickness of the coat. Okay, now if there is a yellowish coat in this stomach area, so we have to consider that there is pitta involvement in this area. Okay, and certain gastric pathology can be present, like peptic ulcers or maybe gastritis or maybe epigastric burning. If there is a blackish or a thick coat of any color, or usually it is whitish thick over this region, we have to consider that the patient might have, irregular bowel movements or incomplete motions or irritable bowel syndromes, any bowel disturbances, bowel urgency or constipation. Okay, I hope I have answered the question of the pathology. um Kindly specify the picture of the tongue nature of the AIDS patient. Which patient are you talking about? If the patient's tongue edges are blackish, what should we consider? If the edges of the tongue are blackish, you have to consider Vatach Dushti in the whole body. We will have to assess it with other clinical assessment as well. Okay. How to understand about dehydration and overhydration of tongue. Generally, a dehydrated tongue looks very dry, devoid of color. Okay, and હિમા મેમ overhydration નું તમને તમે કહી શકશો please?
See, if the tongue is if the system is overhydrated, you will see that the tongue looks a bit more glossy. कफ वृद्धि के जितने भी लक्षण दिखते हैं ना उस टाइप का दिखता है बट जो कोट होता है ना वो थिक नहीं होता है बट देयर इज अ ग्लॉसी शाइन ऑन द टंग लिटिल बिट वाइटिश रस शेषाजीर्ण एंड ओवर हाइड्रेशन दोनों में सिमिलर टाइप की टंग दिखती है we probably have pictures of such tongues, but I think we have not put it in the presentation. Um, there is a अगर आपने ऑयल पेंट मारा है दीवार के ऊपर और एक मैट फिनिश वाला है, तो अगर आप वो ऑयल पेंट वाला वॉल देखते हैं तो कैसी शाइन रहती है, वैसे टाइप की शाइन दिखती है. प्लस ओवर हाइड्रेशन में द टंग इज लिटिल बिट ब्लोटेड एंड अ लिटिल बिट थिकेड. You make out from that that it is overhydrated.
Okay. 15 slide again. Okay. This is a slide. This is a tongue pictures of a patient who is suffering from ILD, interstitial lung disease, where there is usually scarring and fibrosis in the lung tissue. Okay, so what we see from this slide, the first slide is the lung areas show this congestion kind of pathology. Okay, so earlier when the patient had come, she had around 80 to 90% of the tongue of this color. Over time, these are the changes. Also, you can see this bald patches, which shows absence of papillae in that area, suggesting no nourishment is reaching this concerned part of the body. Also, you can see there is a thickness to the edges of this tongue. Okay, over time you see this tongue is there is this blackish brownish coat, but the superficial coat which was above it has been scraped off, and that's why with medicines, and that's why this tongue looks the way it is. Also you can see that this bald patches have started regrowing the papillae. It indicates that the medicines are working and there is costa correction happening. Also the tongue, the coat at the back, you can see the posterior part which is not clearly visible, but from the outlooks of it the coat has reduced over time, which also again shows that over time with costa correction and improvement in the digestion, there has been improvement in this patient, which actually correlates with her initial and recent x-rays as well. Okay, please explain about the microglossia tongue. I'm not very much aware about the microglossia tongue, but it is usually seen when it is in when there is a B12 deficiency, or maybe a hypermuscular hypertrophy, but I'm not very much aware of the microglossia part. HIV positive patient's tongue. Ma'am, HIV positive patient's tongue તમે take over કરશો please.
Frankly speaking, I have had only two in my 23 years of practice. I have seen only two patients who are HIV positive, and unfortunately, I do not have their tongue pictures, but I do remember how their tongue looked like. In those HIV positive patients, I had seen Sanjana, can you put up that slide with that RA and ILD patient's tongue?
Yes.
Do you see this grayish tinge? Sanjana, can you point out on the blackish part?
This.
In the second one,
This.
not the first one. Yeah.
This one? No.
So, yes, yes, that part and the front part. So
Okay.
I had seen in both those HIV patients' tongue that they had lot of these gray colored areas, a darker than gray shade, less than a black shade. Almost in major parts, especially the liver and spleen areas were darker in color, and the whole tongue had a furry coat. They had come not just because they were HIV positive, they had come with a lot of other complaints. So I do not completely relate it to that it would be a HIV because it was HIV positive, those black marks were there. But I remember in both the tongues, there were a lot of black marks, right from top to bottom and scattered. It was not like a full black coated. Another thing was that the sides of the tongue were bluish. In both the cases, they were completely bluish, purplish, as if there was a lot of congestion at the periphery. So that's what I had seen. But if I get to see more patients, only then I can correlate and say what was the connection.
Okay. Aarti ji, are there any more questions?
We don't have any more questions. Just a second. I'll just check. Yes, we have a last question. You can have a look to the question.
Whether macroglossia is related to intellectual disability.
Sanjana,
I'm sorry.
I'll take up that question.
Okay.
See, yes, macroglossia is related to mental disabilities. What happens in those kids, if you look at the structure of their tongue is quite thick, quite swollen. Now, if there would have been a picture, it would have been easier to explain. So, Dr. Parandhaman, if you would have pictures and we can, explain over it, whether how it is related or how we can look at it. So, the general basic structure would be okay, but even in those cases, there is a lot of chance of improvement. Like in patients who would have mental disability, we still, by giving Ayurvedic treatments and the protocols, we can reduce the gap between their mental age and the physiological age. So you can correlate, but still improvements can be made.
In CP patients, there is drooling of saliva.
संजना बोधक का वाला पार्ट एक्सप्लेन करेगा ना.
Okay. So, when there is excessive salivation, we have to consider that there is increase in the bodhak cough in that person's tongue. Now, bodhak cough can increase if there is, arm in the koshta. Also, in cases where there is amajirana, where the patient is eating even without any knowledge of his hunger, which leads to arm development, and thus there is a lot of salivation. મેમ એમાં કંઈ એડ કરવાનું છે?
See, in patients of CP, there is a lot of pratilomen of Vayu. If the pratilomen of Vayu is sorted out in CP patients or in other patients who have drooling, not only in CP patients, but patients who get frequent seizures, patients with Down syndromes, all these patients, if we just cover up the pratilomen of Vayu and we start doing the anuloman of Vayu, the drooling of saliva goes away. So yes, if they are just managed by allopathy medicines, then they give pyruvate or some medicine which is given to stop the drooling of saliva. But when we do lot of ampati, when we do lot of anuloman of wine, all that back pressure which is causing that excess awaran, excess release of the bodha stuff, that gets corrected and the drooling of saliva goes away. So not necessary. If you correct it, then it's not a necessary character that CP patients will have drooling of saliva. You can see the improvement in those patients also. But I don't understand the question. In CP patients, there is drooling of saliva. So what does the doctor want to ask actually? You want to correlate that there is drooling of saliva in all CP patients? Does it indicate that drooling of saliva is only in CP patients? I didn't get the question. You're asking that yes, it can be corrected. Yes, it can be corrected, and you can see it in the tongue. Aarti, can
Yes,
you let
ma'am.
me know who has asked the question?
Regarding the CP patient, there is a drooling of saliva.
Yeah.
Uh, it's Dr. Arathi.
Okay.
Yeah.
Drooling is related to, see, it can be due to excess bodak cough also. And another thing is, if आप अगर जैसे if you look in the whole world, अगर बहुत सारा वायु बढ़ा हुआ है, तूफान है, तो वो क्या करता है, वो नॉर्मली शांत पड़े हुए ओशन में भी तूफान लाता है। उसी प्रकार जिसके अंदर बहुत ज्यादा वायु बढ़ी हुई है, तो भले बोधक कफ लिमिटेड होगा, लेकिन वो क्या करेगा, उसको उखाड़ के वो कफ को बाहर फेंकने की कोशिश करता है, प्रतिलोमन करता है, उसको वहां से निकालता है। So it could be both. Either the cough is too much or the vayu is so much. The cough is in right quantity, but vayu उसको उखाड़ के बाहर फेंक रहा है। इतना प्रतिलोमन है कि उसको बाहर निकाल रहा है. It is not able to go down. वैसा. So these two things can be understood by drooling. Are there any Arishta signs on the tongue? Arishta signs on the tongue that I have seen in personally in my patient is there was a patient who had cancer. He had gallbladder cancer. So I remember his tongue. जैसे वो श्लोक में लिखा है ना कि सन्निपातक उसमें कंटक होते हैं, लिटरली द पेशेंट्स टंग वाज सो ड्राई, ऑल द पैपिले हैड एक्चुअली कम अप लाइक दिस वे, लाइक लिटरली ऐसे माउंटेन्स होते हैं ना छोटे छोटे, वेरी शार्प माउंटेन्स ऑफ स्मॉल स्मॉल साइज, ऐसे कंटक की तरह पूरा ऐसे खड़ा हो गया था, एंड द टंग वाज एब्सोल्युटली ब्लैक, डार्क ब्लैक, and there was a white coat. So this is one Arishta Lakshan that I have seen. But text में क्या क्या अरिष्ट लक्षण टंग के बताया है, that I haven't studied, but this is what I had seen. And I remember that the patient passed away after 3 days. There was another patient who had cancer. She had rectal cancer. She was a very young patient, only 22 years old, rectal cancer, who had traveled all the way from Bihar till here. And I remember looking at her tongue also. She was there with me only for 14 days. Tata Hospital had told that she will not survive even for 1 day. So आप इसको लेके जाइए. That time, somebody referred her to our clinic, and we were managing her under guidance of Dr. Gala, who is our mentor. So we used to examine all the things every day. And there was one Arishta Lakshan which was very typical, which I saw. I don't know whether tongue से related उतना Arishta Lakshan उसमें text में है कि नहीं. I haven't studied that much. But her ear, one ear lobe had become very long, and the other ear lobe had retracted up. Also, her tongue had become very uneven. Like if you put Sanjana, keep a normal tongue now. Yeah. So now if you see this normal tongue, it has a symmetrical margin. You know, if you put a central line from between, you have a left part and a right part, which is pretty much in symmetry. In her case, the tongue had a deep fissure from in between, and her right side and the left side had become asymmetrical, means the left side of the tongue had gone up and the right side had come down completely, which was very unusual. I had seen such a tongue only in one case. So I believe that was an Arishta Lakshan. That point of time I was so much in shock, because I have never seen a patient pass away in my hand, and that patient passed away in my hand. She passed away after 14 days. We tried all whatever we could do, what under Dr. Gala sir's guidance. But then I had thought that I will study more about it, about the Arishta Lakshans. But then, just because of that shock, I think I just stopped studying for 2-3 months. You start feeling helpless that you can't help people at times. Aarti, any more questions?
Ma'am, Dr. Aarti is only asking for drooling related to which doshas?
I explained that drooling related
Yeah.
to kapha dosha and vayu
Okay.
dosha, and arm also. You can consider arm also.
Okay, ma'am. There are no more questions.
Okay.
Yeah. So thank you so much, Dr. Sanjana. Thank you so much, Dr. Hema ma'am, for giving us a good explanation and a good session for the same. Thank you all the participants for joining the session. It was a great session actually, and I want to express our sincere gratitude towards the same. Your presence had made this webinar a success, and we hope the knowledge shared today will be enriching your professional journey. Thank you for being an integral part of our discussion on basic tongue analysis, and we look forward to connect with you again at our future events. Safe travel on your learning journey and have a wonderful night. Good night, everyone, and thank you so much once again. We can end the meeting here. Thank you, everyone.